tuned in to The Andrew Lawton Show.
MAID is increasingly used by people who have run out of options because of the healthcare system, not because they are dealing with a terminal and irremediable condition, as the legislation is supposed to restrict it to, but because they have run out of options, they have had troubles accessing adequate care. And for all that we hear talk about healthcare equity and people who are unable to access healthcare for a number of reasons, why are we seeing such an expansion of MAID? This is something that was put in a very, very important piece in the Macdonald-Laurier Institute by a doctor in my neck of the woods in London, Dr. Ramona Coelho. Barriers to care persist, but access to MAID keeps expanding. She joins me now. It's been many years since we've spoken, Dr. Coelho, but it's good to speak to you again. Thanks for coming on today.
My pleasure.
So explain to me, first off, this apparent double standard here. On one hand, we hear people say that there are these health equity challenges. People in marginalized communities, people with disabilities, they all have issues navigating the system. But many of those people are the ones that are being directed by practitioners at many points towards MAID.
Yeah, it's very disturbing. Right now in Canada, the laws for medical assistance in dying are so permissive, aiming and considering only the narrow lens of accessibility when we are in fact talking about suicide. And so actually we need to protect Canadians by having many safeguards, and we need to have strict eligibility criteria, which we do not have. And so although MAID is supposed to be a compassionate service, apparently for people who have nothing left to offer, it can easily be offered or be used when people have no other options. I was recently interviewed for an Al Jazeera documentary on the life of Rosina Camus, and you can see she had her own recordings and writings near the end of her life. You can even see part of her MAID assessments and how callous that whole experience was. The MAID assessor offering to kill her on the weekend if she had time, and the real poverty and loneliness that she experienced that led to her desperation. So the potential for abuse of people being taken advantage of by a government system is real. As the stats currently stand, you have MAID assessors and providers that are speaking out in Health Canada, saying that, no, this is actually mostly like wealthy, privileged people who are choosing this. We don't have to worry. Most of our cases are for people with who are near death. My article talks about how the Canadian Assessors of MAID, the Canadian Association of MAID Assessors and Providers, actually has created policies to seemingly circumvent those safeguards, so that even if you have just a disability, you're not dying. If you state your intention to refuse care, they can treat you as if you have a terminal illness and end your life immediately. And so you have even less time to recover, even less time for sober second thought. And really that changes how we can interpret the Health Canada reports and stats, because people with disabilities who are marginalized can be hidden under track 1 as if they had a terminal illness just because they were refusing to eat and drink.
I mean, a lot of Canadians have heard, if not, they certainly should, that the famous case of the woman who needed a chairlift in her home and was offered assisted suicide instead. But there are a number of examples of this, and you allude to this in your piece, where people in the disability community are sounding the alarm about this. And the tragic reality is, when you have MAID being pushed on people that have disabilities that aren't in a terminal illness, it's because their life is being valued at less than that of someone without the disability by many of these practitioners, is it not?
Absolutely. So basically, you're making, my friend and excellent author Gabrielle Peters always talks about how our government has created a killable class, a class of people that are seen as having lives less worthy, maybe not even less worthy, but that is merciful to help them end their lives. And really that is based on bias and stigma. The false ideas that somehow they don't enjoy their lives. Most studies show that our society and physicians rate people's quality of lives with disabilities as quite low when they do not. And and also so then you have this kind of idea that we're offering them a mercy and a way out, because really wouldn't they rather just be dead, which couldn't be farther from the truth. But when you have a program that targets people like that, basically when they're suicidal, like Andrew, you shared that you were suicidal at some point in your life. I have also been. But if we appear able-bodied, then all of a sudden we deserve suicide prevention services, although it looks like MAID will potentially expand even for people like us. But for now, if you have a physical disability, if you are suicidal and it's a little bit more long-standing, you might get MAID.
One thing that I've always struggled with on this is that it seems like a lot of MAID providers are already operating well outside the legislation as it's spelled out. I mean, we've heard a number of cases about this, and I'm wondering how that was allowed to happen. Is this coming from regulators that aren't really caring or checking up, or is it just like these MAID assessors and MAID providers are just knowing that no one is going to prosecute them? Because I've personally been aware of cases where someone who would not have been eligible in one province was eligible in another. And this is not supposed to be the case because it's a federal law. So I'm wondering what's gone so wrong here already, even before this Liberal government expansion kicks in.
I have like 10 answers to that, but just quickly.
Please, the floor is yours.
Sorry, I'll say, first of all, very concerning, there is geographic variation across Canada, which shows that there are different cultural practices. Quebec has the highest rate in the whole world right now, as they mentioned in that article. BC, I think, also. Certain areas of BC and even certain areas of Ontario. So the geographic changes should alarm us. It means that there's a lack of standardization. 2, the legislation is meant to protect MAID assessors and providers. It hasn't thought enough about patient protection. Like I said, they've talked about accessibility and protecting the MAID assessors and providers, but not enough thought has been given about patient protections. 3, you have a government that has allowed Health Canada to kind of use our most ideologically, I would say, out there leaders on this issue to guide our policy. That's not usually how we develop policy. We usually try to find a balance. But you have people like Jocelyn Downey, Mona Gupta, people who have basically expressed that they want the kind of widest open MAID regime, who are leading our Canadian policies, which is dangerous for everybody. And then 4th, I would say that, a lot of MAID assessors and providers that I know are actually very concerned about MAID outside the end-of-life context, and they do refuse cases. But all you need to have is a few people who are willing to kill or end the lives of many people, and you have a big problem given the way our system is set up.
That is itself jarring, because I think that for the current time anyway, and I fear that this could be under threat with a different government, physicians have the right to object. And you talk about this in your piece. They're conscientious objectors. But even that you have an issue with in how that's applied. And I was wondering if you could elaborate on that.
Yeah, I have a big issue with, and actually this is what you interviewed with me for a few years ago, is that initially in Ontario, the CPSO came up with this wacky policy, and I'll call it that, called of effective referral, where a physician needs to, again, considering accessibility and timeliness, needs to make an effective referral to another provider who will do the service. And that basically puts patients on a very dangerous path. If everyone has to funnel people onto a death regime pathway, that partly, I think, explains why we have such high numbers in Canada, 16,000 estimated for 2023.
Well, to interject, this is the problem of having only a few people to do it, right? Because now if everyone has to direct them to those people.
Yeah. So even actually, if you're a MAID provider who is not comfortable with the case, and that's what I highlight in my policy piece for Macdonald Laurier. So even if you're a MAID provider who is uncomfortable, so one of the trainees said they were uncomfortable with MAID for poverty. And the experts said, well, okay, fine, your conscience says you can't do this, but you need to make a referral. And hopefully someone else will do it. So if you keep putting someone on a pathway, they're going to find a MAID provider who who, if they continue on that path, which technically if every physician keeps putting them on that path, they're going to find somebody who will eventually do it. And there was a story, I think it came out in the Ottawa Citizen, but an Ottawa paper, about a woman who basically was referred on 6 or 7 times until she finally found someone in Brampton who would complete her MAID case. And they were talking about how sad it was that she had to go through seven providers. And I guess the real question is, like, why were those 6 providers who are okay with MAID not okay with giving her MAID? Like, could it be that this should have been stopped?
Yeah, that's tragic. If at first you don't succeed, try again at its macabre end. Dr. Ramona Coelho, fantastic piece, very grim, but I think important, in the Macdonald-Laurier Institute. Barriers to care persist, but access to MAID keeps expanding. Thank you so much for coming on today.
Thank you for having me. Have a great day.
Thanks for listening to The Andrew Lawton Show. Support the program by donating to True North at www.tnc.news.